Good afternoon, everybody, and welcome back to our latest in our series of COVID weekly updates. We're entering the home stretch of our COVID webinars as we're entering a new phase in the world. So we've got a few really impactful sessions lined up for you, hopefully. Next week, we're joined by Jim Easton, the Chief Executive of Care UK, talking about the role of the private sector in the NHS going forward. But today, we're very lucky to have with us Stephen Bourke, who's a co-founder of Echo, the online pharmacy. Nicely branded t-shirt in case you forget. And Stephen's really going to have a chat with me about kind of the role of tech and how they've responded to COVID, and I suppose a bit about what that might mean for healthcare going forward in the new world that we've touched on previously, really, about how things are changing. So welcome, Stephen. Thanks for joining us.
Hi. Thanks for having me, Tom.
No worries, good to have you here. Can you just give us a very potted history of sort of where Echo came from and what Echo does?
Sure. So Echo is a pharmacy, a digital-first pharmacy that I co-founded back in 2015. The background is I've taken medicine for one thing or another my entire life, and found just the process of managing medicine, getting medicine, dealing with the GP, dealing with the pharmacy, to be a massive chore. I was working up until 2014 for an online doctor service where we were doing private prescribing and pharmacy, and thought, why can't we do this for NHS meds? Why can't we bring technology and convenience to primary care? So it's all good and well doing Viagra, but why can't we do it for atorvastatin and cancer meds and so forth? So my co-founder and I quit our jobs, both sort of patients trying to solve a problem, a very personal problem, make our lives easier. And that's when Echo was born. We went through the whole VC roller coaster, raising money, moving from point to point. And then last year, we sold a majority stake of the company to McKesson, owner of Lloyd's Pharmacy in the UK, but remain an independent company. We are the second largest pharmacy in the country now, so we've got about 250,000 nominated patients, and we're the fastest growing. So we've been adding about sort of 6,000 to 10,000 a week, pretty much steadily since March. Yeah, and it's I mean, it's just been bonkers. Lockdown, COVID, but what's really interesting to me is, I'm thinking hard about it, is ourselves and our main, I guess our biggest competitor is Pharmacy to You. There's a couple of others. Well has a large online pharmacy. Boots has an emerging online pharmacy as well. But combined as a category, we still have less than 2.5% market share. So although growth has been impressive, and we like to joke internally, it takes us 4 years to get to 100,000 patients and 4 weeks to get to 200,000. We are still collectively a rounding error on the national nominations, and it's really interesting during lockdown. Great growth has been fantastic, but been thinking long and hard about what we provide as a category, lack of understanding of that, and the opportunity, particularly regardless of the next wave, but just in terms of sort of the unit economics and costs that we provide, and the potential benefits to health that this thing, smartphone, can provide as well. It's really interesting. So after the initial explosion of lockdown, we're now trying to reflect and think about how do we better describe this category, which gets lumped into online pharmacy, but frankly, online pharmacy is Viagra and sleeping tablets to a lot of people. They don't want to trust it with essential medicines. And from Echo's perspective, we work very closely with the NHS, with NHS Access. I'm an NHS Innovation Fellow, and yet still there's this, I think, mistrust around the category. So yeah, it's been super interesting.
Yeah, absolutely, no doubt. I'm looking forward to getting stuck into some of that. I mean, obviously the growth for you sounds pretty exponential. How soon did you sense that Echo was going to have a big role to play in COVID?
16th of March. So that was our kind of our D-Day moment. So over that weekend, starting with the Chancellor's message, and then leading up to the 23rd, we saw two things happening. One, it was our existing patient base ordering medicines quite desperately, quite urgently. So there was a lot of demand there, and then a lot of new signups from patients looking for a solution. So to the fact that we actually had to introduce a waiting list to ensure that we can, properly service our existing patients. So yeah, I mean, from the 16th onward, things really got quite intense. As a company, we went from one shift a day, 5 days a week, to operating 24/7, so 3 shifts every day. We hired, I think, another 140 staff, very, very quickly. And all of this is, of course, trying to do it under lockdown, and trying to figure out the lay of the land, protecting your own staff, making sure that you have the right equipment and policies, trying to onboard new team members, trying to instill them with what we think is important around patient safety and privacy and so on and so forth, but handling a huge amount of demand from existing and new patients, and really moving from sort of thinking of yourself as a scale up to thinking of yourself as an essential NHS service, and how many people that we can help. And we know every order that goes out the door at Echo is one less travel journey. It's one last visit to the pharmacy, one last visit to the GP, where there's infection risks. I think the other thing that we saw that was really interesting was a massive growth in our average patient age. So before lockdown, typically Echo would attract 43-year-olds. It's kind of the average age, and that went up to 63 quite quickly. It's still hovering at around 50. So we just have a much older demographic now who have different needs.
Is that the whole distribution shifting, or is it?
Yeah, the whole thing. I think it's just the necessity is there, and suddenly people are looking for ways to get medicines delivered efficiently. But from our perspective, it's put pressure on our patient care teams. It's put pressure on our design teams who now need to think about how we serve this older demographic, how we make things clearer. Because I mean, Echo, when we founded it, it was 2 33-year-old guys, and we built the product for that. Now we have evolved significantly since then, but we still, our designers are in their 20s. Our product teams, we're a young team, and actually a lot of our patients have different instinctive needs than what we think is obvious. And that is even with a full-time research team, and having spent a lot of time trying to understand how to better serve. There's just instinctive stuff that comes when you're using a product for yourself versus designing it for a different population that we're having to learn, we're having to adapt.
And in terms of the sort of the, I suppose, the highly pressurized environment, we've heard a lot. We've done a few of these with various people from around the NHS talking about the pressured environment and the need to innovate, and I suppose the less, or the improving of the risk appetite, as it were, to innovate quickly. Something long needed within the NHS. How does that resonate with you? Because obviously you've got huge amounts of like you mentioned, patient safety considerations, etc. How have you managed all of
that? I think it's been relatively straightforward for us. We have a process of how we do things. We have standard operating procedures that didn't change under COVID. I think one interesting challenge is how do you maintain social distancing within a warehouse pharmacy setting. So a lot of the senior team who are based in our warehouse, a lot of their focus was supporting the team and then recruiting sufficient people. But the operating procedure is largely the same. You know, get prescription, dispense medicines. It has to. There's a legal framework for doing that. That hasn't changed. I think I mean, the pressure was significant. As a team, we worked just bonkers hours, and it really took its toll, I think, on our mental and physical well-being. It was quite intense, and it was, again, a huge sense of mission and purpose, but trying to balance that with not burning out, not hitting a wall. But it's been good. I mean, I was looking today at our turnaround times for medicine. So when a patient places an order for when it gets delivered, and now weirdly, thanks to COVID, we are faster by a day and a half. So I think on average, when you order and to when you receive medicine from Echo takes 3 days. So that includes the GP time and the Royal Mail time and so on and so forth. And that was typically 4 to 5 days before. So we've become battle hardened, and we know how to do things more efficiently, and we made more decisions over the period than certainly you normally would for right or wrong, and that has just paid dividends in just our overall operating. How we run the company today, even without that huge lockdown pressure.
Yeah, okay, and that's a really interesting point, because I referenced sort of the NHS culture previously and how they've had to adapt. Obviously, you're coming from a, forgive me if it's the wrong term, from a startup culture, which stereotypically is very quick decision making. Things turn around really quickly. Have you, and then you kind of alluded to it there, have you noticed changes in your culture through having to work in different ways?
Yeah, I think from the outside in, startup culture does look really fast, but actually it can be stymied by the exact same problems as a big business. From Echo, from when we started in 2015, has grown to 240 people, and with that you have layers of management, you have ways of doing things. You have to do things in a scalable way. You can't just go, hey, let's go and do that. So what was interesting, I think, about lockdown was, my impression is we kind of went back to our roots a little bit. It was much more about sort of problems to be fixed, fires to be put out, as opposed to some of the more incremental, longer term gains that you focus on as you're scaling up. Yeah, it was really interesting to see, again, people in the company who are very startup-y, how they responded to it, because it was back to the early days. I mean, in the first few years of a startup, every problem is an existential problem. So you run out of cash, you have to do fundraising, you develop a product, and then you realize it doesn't work. All of these things can just kill the company overnight. When you're in a scale-up phase, and you move away from that firefighting panic to more iterative process, and that has to happen. By the way, I'm not saying it's not preferable. It is definitely preferable, but COVID brought us back to that, back to the roots, which reminded me how stressful it was back in the early days as well.
Good. Well, I'm hoping you're seeing a way past that as well. So most of our audience work for sort of larger healthcare companies, pharma and med devices and tech companies. What do you think might be some of the transferable learnings from your experience in terms of innovating, changing practice, improving patient care ultimately?
Well, I think what my old colleague used to say to me, which definitely rings true, particularly during this period, is more is lost to indecision than the wrong decision. So just do it. I used to work for a large corporate if you go to my LinkedIn, you'll guess who it is. And I spend a lot of time there writing business cases to validate points made by senior people. You can always make a business case to say whatever you want it to say. It's built on assumptions ultimately, and unless you can time travel, you're going to be guessing. So I think analysis paralysis, spending time thinking about should we, shouldn't we. We didn't have that luxury during lockdown, and it freed us from a lot of meetings. So I think what I'm trying to get my head now is how do we retain the best part of that culture. It's also not necessarily the best way to run everything, and just say, well, let's not analyze things. I do think there is a role for it, but certainly just making decisions and going with it, you can always correct course down the line. It doesn't have to be the end of the discussion, but waiting for perfect conditions and for your strategy slides to align so that every Venn diagram comes to the same middle point. It's a complete waste of time. And it's just a complete false sense of ROI versus having a hypothesis, test it, then push something out to the market and see if it works. So that's the main thing. And certainly at Echo, it felt that we got much more back to that way of working. It's like, we have this problem, now we need to go and fix it. Is it the perfect fix? Probably not, but we do need to fix this, and then we can iterate and go and go and go. So I think there is a tendency in corporate world to just avoid risk because it is an incremental gains culture, which kind of is a factor of the size of these companies. And the challenge is if you avoid risk, then you also avoid the potential returns. So when I see corporates trying to innovate and they talk about, well, we want to become more agile, we want to become like a startup, they have to also remember that most startups fail, and they have to be prepared to fail, and for what that means for them as individuals and their careers, and also for them, for the company as well. But generally speaking, when you look at some big bold bets made by companies, when the company is properly committed to making it happen, it tends to work just by default. So take some bets.
And what you're seeing in your capacity as an innovation fellow as well with the NHS, are you seeing that kind of thinking and culture coming more into the NHS? Is there a receptiveness to it? I think there's lots of talk around it, but is it?
Yeah. I think I'm seeing lots of talk. I think pharmacy is really heavily regulated, and I was talking to a colleague at NHS last week about how weirdly it's one of the most regulated elements of healthcare. We've had lots and lots of conversations with people across the NHS over the past month, all of whom are super supportive, want to get stuff done, want to change, see the opportunity to use technology like ours and others to transform just primary care. What is the new normal? But come up against the old challenges around contractual frameworks. Right. This is how we do things. Vested interests within the system that make it difficult for them. So, I guess expecting it to change quickly, even under COVID, is a lot. It feels like it's going in the right direction, but you have lots of, I think, good opportunities that require risks, that require someone to stick their neck out, and it's hard to do that with so many other things going on. It's every time they launch something, they get so much grief from the press. Every initiative that gets pushed out, it's like, oh, again, it's not perfect, therefore it's wrong. And then we're going to see it with the contact tracing app. We're going to see it everything. They're under so much scrutiny. It's a really, really tough gig, I think, for the team there. And so we're all on the same side, but I think they've got a really tough task, and they're trying to shift cultures embedded not just at Skimpton House and at the Department of Health, but in every community, every GP surgery, every pharmacy, and that's hard. And I don't think that COVID, unfortunately, doesn't feel like it's been enough to unlock some of those cultural changes.
That's an interesting point. So my next question, I suppose, was going to be around kind of that cultural thing, and in other parts of the NHS, we've heard that, you know, people feel this is a bit of a tipping point in care delivery, and particularly around integration and delegated responsibilities and those sorts of things. Do you see this as a tipping point in care delivery?
I don't think a tipping, not within a pharmacy context, unfortunately. I've seen some really cool stuff happening with regards to, for instance, GP consultations, digitization of that, which definitely could be considered a tipping point. But within pharmacy, no. I think more is required, and it's just really hard to make change there. But it is going in the right direction, so it does feel very positive. I mean, the growth is there, the solutions are there, but what I see ourselves and our direct competitors, I see us having a really good solution for lots of patients who are looking to self-isolate. I see it as a good solution for people who struggle to get to the pharmacy even when pre-lockdown. But the market is still confused. Patients are getting mixed messages. I mean, if you type in, for instance, go onto Google right now and type in buying medicines online, the first link after a whole bunch of ads trying to sell you Viagra, the first organic link is the NHS, who have a webpage saying dangers of buying drugs online. Okay, very hard when you read that and you think about how important your medicine is to you and to your life, to then go, oh, okay, what's the difference between Echo and one of these services? So there's a lot of opportunity, but there's also a lot of pushback. We'll get there, but I don't think this has been the tipping point for pharmacy yet.
Yeah, no, that's really interesting. And I suppose from across, you're really well connected to, you know, other people in your sort of tech world. Again, forgive my naive language there, but what's kind of the best of the rest? What have you seen that's really come to the fore? Over the last few years?
I mean, there's no way that I can't mention Accurix. So, you know, Jacob and his team there have, I think, been the superstars of COVID. Got 93% of GP practices using their technology. So yeah, I mean, really exciting to see the journey that they're on now. They are going to proper tipping point growth, and it will be exciting to see, you know, what they do and how they innovate within a space that, you know, has two big old school providers. Well, not old school providers, but, you know, like the dominant names, and then you've got a new force that's come in. So it'd be interesting to see how they shake things up, and also how they're inspiring others in the system. So definitely, I think they're super interesting. Another, you know, one that I'm really interested in is MyGP, so the iPlato team, who, you know, full disclosure, we have a partnership with. But being able to see how their app and service has been deployed in new settings during COVID, to see their growth again as a patient portal for ordering prescriptions, booking appointments, and really lots of the exciting things that they're doing to help with care pathways. But yeah, I mean, Accurix are smashing it at the moment. So yeah, fun times for those guys.
We'll get them to send you a check for that later.
They don't need the money. Honestly,
fair enough. We'll get them to send you the check. What are the risks, do you think, in the digital healthcare world going forward?
I think you know, so there's a few different things that I think about when I think about the digitization. So one is, a common thing to bring up, but it's privacy and data concerns, and how do we continue advancing from a tech perspective without falling foul. I mean, mistakes happen by default. No product ever gets shipped without a bug. And so we have to be able to balance the need for progress and evolution of tech against the potential risk of data breaches and so forth. So getting that balance right, I think, is really tough. Yeah, we need to look at the bigger picture here. So that's kind of the one, I think, the obvious one. The less obvious one for me is the social interaction and human aspect of primary care. So community pharmacy is an example. Many people go to the community pharmacy and enjoy going in there as part of their their weekly regime because they like talking to someone, they like having that interaction, they like the human connection, and it's hard to replicate that online. We're sat here, Tom, talking over the internet, and it's great, I can see you clearly, but I think we would have a deeper connection if we were sat together drinking a coffee face to face. And one of my concerns about the march towards online services is what happens to those people who rely on primary care for their weekly dose of human contact. Isolation in the over 65s is a huge problem. I think it's something like half of all over 65s see the TV or their pet as their main source of companionship. And so by removing a lot of these face-to-face interactions, be it through Echo, be it through an online doctor service, we're cutting that off, and it feels like somewhere in the system we're going to have to pick up that slack. And that's the reason why when people talk about online pharmacy versus offline, I always say, no, it's not about that. It's not about a all or nothing scenario. It has to be a hybrid model. It has to be something that takes into account the patient experience from being a feckless 30-something who just wants medicines delivered because I'm too lazy, to down the line needing the care, attention, and services of a face-to-face community pharmacy. And I think that, so again, we need to try and build a hybrid model here, or else we're going to create a new set of problems for society down the line.
Yeah, absolutely. And that's a fantastic sort of human perspective, because I think probably everyone thinks everything's going to be digital and things will change. So that's really, really good to hear. We've just got sort of a minute left. So I just wonder if you can sort of summarize, what advice would you give anyone looking to design some sort of digital health innovation? What's your legacy to the world?
Go and work for a bank. No, I think the main thing is, the startup world is seen as we touched on before, as being super agile. Because of the patient safety and privacy concerns, healthcare it's just harder to launch a product as a sort of an alpha. Let's build something, stick it on the app store and see what happens. So you need more investment. You need to take more time to get there as well. So you need to give yourself a longer runway, because just trying to get your head around what data needs to be retained on the GDPR, depending on the different data sets, is a huge task. So I always advise that if you're going to go into digital health, tenacity is probably the main thing. And then the second most important aspect for me is working with others, be it your competitors, be it your people in adjacency, be it people in the NHS. It's a huge market, and I've had some of the best advice and coaching from some of the guys in my competitor pharmacies. So I would name Andrew at the Co-op as one of the my go-to guys, even though we're both going after the same market. Similarly, when things got very tough over COVID, I reached out to Mark Livingston, who he's more experienced, and he was able to give me some really good sage advice. And so healthcare healthcare is just different. It's not e-commerce. We have to work together because yes, there's potential financial prizes, but really the real prize here is finding a way to sustain free access to healthcare in an aging society. And digital is the only way we're going to do that. It really is. It's the only way, or else we'll move to a private model, which will leave people behind. And I really believe like working together with everyone in that ecosystem is super important.
Fantastic. I think that's a cracking lesson to end on as well, and probably there's a lot of us that could learn from that sort of collaborative mindset. So I think we're out of time now, so thank you, Stephen, very much for joining us today. Hopefully everyone at home enjoyed that as well. Really insightful, I thought. Next week we are going to be an hour earlier at 1 o'clock to fit around Jim Easton's diary. He's the Chief Executive of Care UK, and he's going to talk to us about all the elements of private healthcare, including care homes, prisons, all the various things they do, as well as private hospitals and other services. So join us next week, 1 o'clock, and thanks again to Stephen. Take care. Bye-bye.